And we'll try to follow that with this time of year. There are a lot of salty snacks available, but they're not for everyone. Of course, it's the holiday season, and Dr. Robert Felder is here to talk about salt sensitivity. So what makes somebody salt sensitive?
Salt sensitivity comes about when you eat too much salt and then your body has to dilute the salt because your body can't take too much salt inside, and it builds up your blood volume and you get high blood pressure. And so that's salt sensitivity, but the high blood pressure is due to the salt, not people who are hypertensive.
Okay, so what happens if you have too much salt? And we're talking sometimes with salt, minuscule amounts that can kind of affect you.
Yeah, you need a teaspoon a day or less, and so anything over that is problematic for almost everybody, but people who are salt sensitive should certainly have less than a teaspoon of salt.
Right, you mentioned high blood pressure. What are some of the longer term effects of that coming as a result?
Well, hypertension or high blood pressure is elevated pressure irrespective of anything. Your pressure is just high. Salt sensitivity, you can have perfectly normal blood pressure and still be salt. And what the issue is that the people who have salt sensitivity and normal blood pressure don't get seen, they don't go see a doctor because there are no symptoms. But it reduces your life expectancy by 20 years.
So this is something that you either maybe don't see coming or don't even know once it's here.
Absolutely. It's a true silent killer. And the fact that it takes 20 years off your life is now a scary silent killer.
Absolutely. All right, so there's a clinical study coming up that you guys are doing. Let's talk about how people can get involved in that and who might want to get involved.
Okay, we're recruiting 3,000 people so that we can check certain genes, which we have shown over the last 5-10 years to be highly correlated with salt sensitivity. And so what we're going to do is from that group of people, we're going to pick those that have the right genes, and we're going to invite them to participate in a 2-week study where we provide 100% of the food they eat for free. And so that we control the salt through those diets, and so they'll have a very high salt week and a very low salt week. And we look for the blood pressure change. And if you have a big blood pressure change, you're salt sensitive.
Interesting. Doctor, appreciate your time tonight. Thank you. Sharon?
Okay.
All right, gentlemen, thank you.